Hello, everybody. It's the top of the hour at noon, so we will go ahead and get started. My name is Deb Moats, and I am the newest member of the AHA Quality and Systems Improvement Team. I am the Senior Director for Stroke and for AFib for our six-state Southwest affiliate. I am joined today by Takia Wilson. Takia is the Director of Quality and System Improvement for Dallas, Fort Worth, and the affiliate lead for our AFib. Welcome to our first AFib Quality Exchange. We're putting together a quarterly phone call to allow our hospital teams who are working diligently to improve AFib care to come together to learn, share, and identify resources needed. I hope you'll invite your colleagues to join us. Everyone is welcome on the call. We are also holding quality exchange calls for heart failure, stroke, and resuscitation, and actually this is the fourth one in the last 2 days and final one for this quarter. And then we also have webinars for coronary artery disease. If you haven't heard, the American Heart Association has relaunched the Get With the Guidelines CAD program that supports Mission Lifeline and a collection of STEMI and non-STEMI patients. This module is available at no charge for this calendar year, and they're having weekly webinars. So if you want more information on the new tool, you can email the Southwest affiliate, swaquality@heart.org. And then you can learn more information on the weekly calls, which take place every Wednesday at 1 o'clock Central Time or noon Mountain Time. You have been placed on mute. To join the conversation at any time, select *6. I really encourage you to participate, share your ideas, share things, because this really is, this program is going to be meant for you, or these calls are meant for you, and so that we can work together to help improve our overall AFib care. *6 will unmute your line, and when you're done speaking, *6 will remute your line. If you need to leave the call early for any reason, then please take the time to go to our survey and let us know that you are here. We did not have a registration this time. We wanted to make it as easy as possible for you, but that means we really don't know who is on the call, so we plan on sending out some links, some information, some resources to you after each of these calls. So if you register, then we'll know that you're here, and we can send you either the information or send you a link to the information. To get to the Southwest Affiliate Quality page, you can Google QI in the Southwest Affiliate. You do need to spell out Southwest, or else it will take you to some other website. But QI in the Southwest Affiliate, and then our page on the AHA site will come up. If you scroll down just a bit, there are 2 tabs. One of them talks about webinars that are going to be that are either available or will be available, so you can kind of keep an eye on that site. And the other tab is the Quality Exchange, and that will be for all of our modules. So if you select the Quality Exchange tab and then click on the registration link, then we can get documentation that you are here. That will help us to evaluate our calls and then to learn what other additional resources you need. The survey itself is very short, 7 questions, and it should only take a few minutes. So please do take the time at the end of the call or whenever to go ahead and register. So for today's topic, the call will include, we'll go over just a little bit of the purpose of this initiative. And during this time of the call, think about what you want to learn about or discuss in these calls. And again, we really, really encourage you to participate, because sharing, you guys are the ones that are doing this work every day and can really help one another on issues and problems that you're seeing. Then we're going to do an overview of the achievement measures, the 2016 and the 2017. We'll talk a little bit about the patient management tool update that was recently done, July 26th. We have the new ablation feature, if you're not aware of that, and we'll talk a little bit more about that, as well as the electronic health record adapter. That is something that's been developed to help with the abstraction. We'll talk a little bit about fallouts that we're seeing, and there we really hope to have the group discussion and people really sharing some of your issues, some of the things that you see and how you're addressing them. And then we'll close with giving you some resources. But most of all, we do want to hear from you. What are you struggling with? What do you want to learn more about? And how are other hospitals addressing? How are other hospitals addressing this? So we're going to go ahead and get started. For the introduction, atrial fib is the most common sustained cardiac arrhythmia. It's the cause of stroke, heart failure, and death, most common cause. AFib is a common clinical problem with significant morbidity and mortality. There's guidelines-based treatments that can improve these outcomes, and that's what the Get With the Guidelines program actually is for. It's a national hospital-based AFib quality improvement program, and it's designed to increase adherence to the evidence-based guidelines for atrial fib. So the purpose of our calls that we're starting, you may have received a report if you currently are a part of Get With the Guidelines AFib. We are sending out quarterly reports. Your directors from each of your regions will be sending you quarterly reports. The quarterly reports are actually just a snapshot of what's been entered to date, because as you know, these are very fluid patient management tools that are constantly changing as information is being added. But it'll give a snapshot of where you are currently with your in your award achievement journey, I guess. And think about what you want to learn and discuss, and we are really here to facilitate this exchange. So next, I'm going to introduce my colleague, Takia Wilson, and she's going to do an overview of the achievement measures. Takia?
Hi, good afternoon, everyone. Thanks, Deb. As Deb mentioned, I definitely wanted to just provide a quick overview of the AFib achievement measures so everyone can be more familiar and just have a better idea of what they are. So the first one is the ACE-R of a discharge for LVSD. And here we're looking at the percent of patients with a left ventricular systolic dysfunction and without both ACE and R contraindications who are prescribed an ACE and R at hospital discharge. Now, for purposes of this measure, the LVSD is defined as a chart documentation of a left ventricular ejection fraction less than 40% or a narrative description of left ventricular function consistent with moderate or severe systolic dysfunction. The second achievement measure is the assessment of thromboembolic risk factors. And here we're looking at the percent of patients with non-valvular atrial fibrillation or atrial flutter in whom assessment of thromboembolic risk factors using the CHA2DS2-VASc risk criteria has been documented. The third measure involves the beta blockers at discharge. This is the percent of patients with left ventricular systolic dysfunction prescribed a beta blocker at hospital discharge. The fourth measure discusses the discharge on FDA-approved anticoagulation therapy. So this is the percent of patients discharged on warfarin or other anticoagulant drugs that is FDA-approved for the prevention of thromboembolism for all patients with non-valvular atrial fibrillation or atrial flutter at high risk for thromboembolism, according to the CHA2DS2-VASc risk stratification score. The fifth achievement measure for AFib is the PT-INR planned follow-up. So here we're looking at the percent of patients discharged on warfarin who have PT or INR follow-up plans prior to their hospital discharge. And the last measure, there are 6 total, but the last achievement measure is for the statin discharge in patients with coronary artery disease, cerebral vascular accident, transient ischemic attack, peripheral vascular disease, or diabetes, who were described as statins at their hospital discharge. So I know that was a kind of quick overview of the AFib achievement measures. I'm going to pause right here before I go any further to see if anyone has any questions about any of the achievement measures. And just remember to star 6 to come off mute if you have any questions. Okay, so if not, I want to just make a mention of the new 2017 measure calculation value add. So for this year, the measure calculation for AFib for the new measures for discharges on or after January 1st, we now have capability to document the exclusions and exceptions. So as I mentioned, this allows for better documentation, and it gives us a more defined overview of what the documentation has to be for the exclusions and the exceptions for these particular measures. So does anyone have any questions after that? If not, I'll turn it back to you, Deb.
Okay, thanks. Star 6, if anybody has any questions or comments, we'll give it just a second here.
Okay.
Okay, so we'll move on. The next part that we would like to talk about is the PMT update. So just an overview of what the patient management tool, which is actually the AFib patient management tool, what the functions can include or what it does include. So for the PMT function, you can collect data and reporting. There's patient-level reporting, so it'll help to spot individual problems that you may see occurring. You can track your physicians. You can track them to evaluate their performance, and you can track them by physician group or by the individual physician. You can use this as point-of-care tools, including patient education. There's a lot of patient education educational sheets that you can download right from your Get With the Guidelines website that are really good and may be helpful for your patients. You can download the raw data for additional analysis, and I know that we've had some issues, which I'll talk a little bit about as far as the reporting goes, but there is always the capability to download the raw data and manipulate it in an Excel spreadsheet and to kind of see where you're at. You can also do real-time benchmarking by hospital size, by region, and other variables. So I just looked a little bit ago, and currently there are about 175 hospitals that are using AFib. So it's one of our smaller modules, one of our newer modules, but we're really starting to see growth in the use of this module. So currently there are almost 45,000 patient records that you can benchmark against to kind of see how you stand up to other people with all the hospitals, with just your hospital, and then typically there are several other choices so you can compare to hospitals in your own area. You can do real-time data checks to identify potentially entry errors prior to submission. And then the real-time reporting is probably one of the best things. That can help to eliminate the delays in the performance feedback. So some of the fixes that just happened, actually let me stop there just for a second and see if there are any questions about the functionality. Okay. All right, so on July 26th, there was a release updated, and there were several measures that were having problems, and they are now fixed. So the new measures were released, the new measures were implemented in January of 2017. Takia talked about that, and the measures are applied to discharges on or after January 1, 2017. Now, there are the old and the new measure descriptions, and you can find those still in the tool, the patient management tool. And for this year, for recognition for 2017, you can actually use the performance achievement measures from 2016 or from 2017. Starting January 1, 2018, then it will just be the latest version or latest achievement measures that will be available. So at this point, you can use either one for this calendar year for the Achievement Award. To actually look at your reports, and most of you hopefully know how to do it already, but if you go to your report, if you go to the configurable measures, it's under site level reports, there's configurable measure reports. You click on that, and then there's the Get With the Guidelines AFib achievement measures. So you can actually download your results. You can pick your time period if you want a quarter, if you want a monthly, if you want an aggregate level, whatever information you're looking for, then you can choose that, and then you can run the report. One of the things you can do with the achievement measures is if you go down at the bottom of it and use the filters, the filter option, then you can actually, I think it's the filter option, you can actually put as all of the measures, you can choose all of the measures on the same graph, and then you can also include the achievement level line. So you can see very easily on your report, if it's aggregate, where you fall to date on any particular measure. So where's the new measure logic and rationale? Each one of those are under the measure description, and that's included in the rationale and guideline statements that correspond with the measure. So there is a summary report of the old and the new that's on the Get With the Guidelines, on the what do you call it, the references that you can look at. So you can look at the coding instructions. You can also look at the differences in the measures there. There's like a 35-page document that goes through each measure. So if you're interested in seeing that, it also goes through the level of evidence that supports that particular achievement measure as to why that measure was chosen. For the actual measure calculations, so the issues that were identified with the 2016 and 2017 measure calculations, the first one was the new measure logic that records with a discharge on or after January 1, allowed you to include patients with bioprosthetic valves. However, the script, when it was running, so the bioprosthetic valve is required. The fix on that was the bioprosthetic valve can add a patient to the denominator, but it's not required, but it may not be required to be included in the measure denominator. So that affects several of the measures. It affects the CHAD score, CHAD's VAS score. It could affect the anticoagulation prescribed at discharge. It could affect the PT-INR, planned follow-up documentation prior to discharge for warfarin. So that was fixed on June 26th. So those should all now be fixed and available. Another issue that was identified was the CHAD's VAS risk score was documented prior to discharge. It was used in the wrong data elements to calculate the measure. So it calculated whether or not the CHAD's VAS risk score criteria had been documented in the medical record. That was a change from the old measure, which just looked at assessment of thromboembolic risk factors. And because it used it to look at whether the risk factors were assessed, they're now actually looking for a documented score. So they want to see an actual documented score by a physician, by a PA, by a nurse practitioner. And so the script is using the calculated score and not the documented score from the medical, which was incorrect. So that is now fixed. The quintiles will correct the measure calculation to use the correct data elements so that it's calculated correctly. And again, that was done on July 26th. Another issue that was identified was the ACE, ARB, and ARNI at discharge. That measure was written so it said ACE and ARB or ARNI, and it actually is ACE or ARB or ARNI. So that measure has been fixed as well. There was a way during that time that you could download again. If you downloaded the raw data, then you could look at that and see whether or not at least one of these medications were prescribed. So you were able to follow the measure, but it did not calculate it correctly when you just tried to run your report. The CHAD's VAS risk factor assessment was on the historic tab, and that now has been moved to the in-hospital tab. And the patients with mitral stenosis or mechanical valves were included in the denominator already, unless explicitly included for the measure. So PT-INR planned follow-up documents prior to discharge for warfarin treatment. So the patients with non-valvular AFib are not included in the denominator, which was incorrect, and that now is fixed as well. And then the anticoagulation therapy education was missing for anticoagulation prescribed, and again, that is fixed. So all of the measures now should be fixed, and all should be working so that you can continue to monitor throughout the rest of the year to put in any processes or practices that you may need to change. So again, I want to stop there, and if anybody has any comments or questions, *6 to unmute your line. Okay, so those were the fixes. The other thing that happened with this new update was the AFib accreditation measures. So they are now aligned with the ACC and the AHA atrial fibrillation Cornerstone accreditation program. So with the Cornerstone accreditation program, it's for the CVCOE, or Cardiovascular Center of Excellence. Atrial fib is one of those cornerstones, and heart failure is another one. And so those now are aligned so that when you run your reports or enter the information, the data elements to support the accreditation are now available. So for information on the accreditation, you can always email accreditation@heart.org or visit www.cardiacaccreditation.org. Okay. Any questions, comments on that?
You have a question?
Oh, thank you. Yes?
I noticed that when the patient's anticoagulation was contraindicated, that coagulation was contraindicated, it's shown a fallout for the anticoagulant education. Well, obviously, we're not going to educate on something that wasn't given to the patient.
No. So is that since the July 26th fix that you've noticed that?
Yes.
Okay. So again, tell me again what it is so I can jot it down and I can follow up.
Okay. So if the patient requires an anticoagulation, but the doctor writes it's contraindicated due to risk of bleed.
Uh-huh.
Okay. When we put that in, it's contraindicated. Then it's showing up, it's asking the question, is there an anticoagulant education done? We'd put no because, it was contraindicated, so we're not sending them home on one. It's showing up as a fallout.
Okay. So there's not a choice for the NC, not that it doesn't really fit that measure, so there's just the yes-no option?
Yeah.
Okay. All right. I will follow up with Quintiles on that. And when we post the information as far as what we're learning from this or resources that we have available, we will have an answer to that question as well.
Okay. I have a second question also.
Okay.
Okay, so if I understand this right, if the patient has been here for AFib and they have a history of diabetes, then they need to address the statin, correct? If the patient is in an age bracket of 40 to 70 and the statin is less than 70, then it says no statin needed. That's correct, right?
Yes.
Okay, but in the data abstraction, it never asked to put in an LDL.
So does it give you that option as a the no statin needed as an option to address the contraindication?
Well, it's not really contraindicated. It's just not ordered.
It's not needed.
Because it's not needed. I mean, it sounds the way it's written. It sounds like it's automatic. Don't worry about it because it's low. Okay. And it also gives parameters if they're under 40 and if they're over 70. So we've been doing LDLs to see if it's even needed. But in the abstractions, they're falling out because there's no way of saying, well, yeah, the LDL was like 40. They don't obviously need a statin.
Okay, so I'm going to need to look at coding instructions, but I know for the stroke one, actually I did just look at that for the 70.
Yeah.
And it really didn't say, even though you document what the LDL was for stroke, if it was less than 70, it still had it as a fallout unless you actually clicked yes, that there was a documented reason. And the documented reason was that it was 70, and that was it's just an automatic standalone reason.
Okay, so we would click contraindicated just on our own. We wouldn't need a physician to write contraindicated because it was 40.
Yes.
Because it's a standalone. Okay.
Right.
That's good to know.
Okay.
That was it. Thanks.
Thank you. Any additional questions? Okay. Thank you very much. So the next thing that we are going to discuss is Takia is going to tell you a little bit about the ablation feature, the new feature, and also the electronic health record adapter. So Takia?
Thanks, Steph. Yes, I'm here. So we are targeting a new area of AFib care at the AHA. So we definitely wanted to introduce the Get With the Guidelines AFib ablation feature. The use of catheter ablation as a care option for AFib in patients is definitely growing. So we wanted to have a way to be able to document and benchmark its use. So this particular ablation feature is offered at no additional cost to participating hospitals. The new feature not only tracks and benchmarks catheter ablation treatment, but it also provides a 180-day follow-up form to measure post-ablation patient outcomes. The reporting capabilities seems to be like endless, but there are like 18 that we have that are particularly coming soon. A few of those include indications for ablation, in-hospital mortality, sinus rhythm at discharge, the length of stay for the ablation, the actual ablation procedure rate, the ablation procedure type, ablation anticoagulation strategy. It kind of goes on and on. Energy sources, procedure, and fluoroscopy times. So this is definitely something that we think is going to be more useful for hospitals that are seeing the growing number of catheter ablation in their patients. So for more information about it, remember it's no cost for participating hospitals, but for additional information, just feel free to contact your local QSI director or just email us after the call. And I'll pause there before I talk about the EHR adapter to see if there are any questions about the new ablation feature for AFib. Remember, *6 to come off mute if you have a question. Okay, well, I will move on to the electronic health record adapter. And this tool was basically developed to reduce the burden of data collection. I'm sure we all have that burden at some time throughout our day. But this particular tool is to capitalize on the data that hospitals, abstractors already have access to or available in their electronic medical record for Get With the Guidelines AFib registry population. So this particular program has expanded its functionality to include integration of data from hospitals' electronic medical record. It could be Epic, Cerner, whatever particular hospital EHR system you're using. It should be compatible with this particular adapter. So it will be used to generate and populate patients' information automatically, which is pretty nice. The integration creates efficiencies to the data entry process, saving a lot of time, like I mentioned, for abstractors, and it allows for a manual or systematic process to upload the EHR data into the AFib Get With the Guidelines registry. So basically there are two ways that hospitals can participate in the EHR adapter. The first one is hospitals can submit the EHR data using a standardized language, which is kind of how the EHR record talks to the Quintiles patient management tool. So that particular information will be mapped by Quintiles and submitted to the Get With the Guidelines patient management tool registry. So, again, this is a great option for sites that have minimal resources, but they still want to engage fully and prepare their files and ensure like data is entered on a systematic and routine basis. The second option, I'm sure most people have heard of, the CSV, the comma separated value. It's an uploader that has been mapped to registry specifications for secure file transfer. This process can be automated or manual, just depending on the hospital's preference. So two options hospitals have, the CSV uploader for the option to have the EHR manually or generate the population for the data in this particular registry for the patient. So while you are thinking about that, just be mindful that we are definitely here for you. Like I mentioned, our QSI directors are well-versed in the knowledge and the background for the implementation of this software. So we're definitely going to work with you, members of your hospital IT department, and to basically help you determine which method of submission is best for you. We definitely want to provide the support and guidance through the file preparation and the submission process. And then we'll also be there to provide ongoing support and following the implementation and help you, with your data solutions as you relay that information back to your leadership team and quality committees at your own hospitals. So this particular adapter is free for early adopters. So if you think that you want to get access to this particular software, definitely let us know because it's free for a set number of early adopters. So just let us know at the end of the call. We'll send out information about it. Or if you have any questions right now, definitely star 6 to come off mute and just ask any questions about it. And that is what I have for those 2 topics. If anyone has any questions, just star 6 and we will answer your questions. Okay. If not, Deb, I will toss it back to you.
Okay. Thanks, Takia.
Sure.
So the next thing on our list to talk about are the fallouts and what kind of things that you are seeing in your own practice. What we'd really like to hear about is what are you having problems with, and also what are you doing with the tool, and do you have committee meetings? Do you have an AFib, like a committee, or how are you actually using the tool to improve your care? So would somebody please talk a little bit about your involvement with the AFib program? Anybody? Can we get kind of oh, go ahead. Go ahead. Hello? So can we kind of get a feel of the people on the line, like what hospitals and where you're from, so that if other people have some questions or comments or would like to connect, maybe we could kind of get a feel of who's actually on the line and who's interested in this topic. So would somebody just kind of introduce yourself and let us know what you're doing, why you're here?
Yeah, this is Richard from Doctors Hospital in California.
Hi, Richard.
Okay. We just started the AFib in our facility, so we've been kind of just playing by ear what's going on. The biggest problems we're having is the statin. A lot of physicians just don't seem to want to address it. And the tools-wise, the CHADS-VAS, we're also having issues with the physicians wanting to document the CHADS-VAS. So we've actually had a sheet printing out, so when the patient comes in, the nurses will fill it out after they do the H&P with the nurse or the patient, and then we'll call the physician on the results. And that's how we've been kind of dealing with that.
Okay.
And that's about it.
Thank you for sharing that, Richard. Anybody on the call also having problems with statin, or is there anybody on the call who actually is not having problems with statin, and what did you do to address that so that it's covered? This is a really good time to share best practices. Nobody wants to share?
So this is Teresa, and I'm in Colorado, and I'm a data abstractor, and one of the registries I do is AFib, of course. And we didn't necessarily have an issue with the CHAS-VAS score, nor the statin, but what we do is on a quarterly basis, we present all these achievement measures to the folks that do the AFib procedures primarily, and that definitely had a big impact. So they see, oh, we're only at, I don't know, making up stuff, 20% of our patients that we documented CHAS-VAS. What can we do to improve that? And that's happened a lot. And we've been, I've been abstracting the registry now for over a year, so definitely have seen a big improvement just by presenting the data to those that are directly impacted by the data.
Thank you, Teresa. So is this like at a medical executive committee or like staff meetings, or where do you present the information?
It's pretty simple through email. Yeah, we just prepare a PowerPoint slide or so, or even Excel spreadsheet with the data on there, all the different achievement measures and what the percentage is and where we are as far as compared to other hospitals in general.
Great idea. It really does seem to help if you keep people informed as far as where you're at, because everybody wants to do good, nobody's there to do a bad job, and if you can really see what's happening and what's going on with those measures, then it can make a huge difference. So that is a wonderful idea. Anybody else? Can you share any information?
Hi, this is Sarah Henderson from San Antonio.
Hi, Sarah.
Hi. When it comes to the CHAS-VAS score, I think what we see over and over as far as the uphill battle is when we have a patient who has a history of AFib and they're already on an anticoagulant, getting the physicians to reassess the patient and go back to thinking about a CHAS-VAS score, it's not necessarily on their radar to document that because they feel like that has already been addressed and is being dealt with. So that's kind of been our uphill battle when it comes to the CHAS-VAS score. I think when it's a newly diagnosed patient, no problem, because they're thinking about all of that for the first time. And then I would say the statin has been our hardest issue as well. But now that I know that we can use the LDL levels, I think that's going to be very impactful on our data.
Great. Thanks, Sarah. I think I will need to double check that. I want to make sure that that's correct, because what I was referring to is the stroke one, but I'm not sure that it would make any difference with the other one. So I will verify that again and post that information. But I think the guidelines or the coding instructions have been updated now. So anything that you're falling out on, you may want to just take a look at the coding instructions and make sure, that you're giving yourself every opportunity for improvement. But I think, the CHAS-VAS score, so do you have like order sets that you use for an atrial fib patient that comes in or anything like that?
This is Sarah again. We did. And we had paper forms, and due to a change in our EMR, those are no longer being utilized. And so we're in the queue to have something built, but that's going to be a long way off. So we're starting all over with re-education as far as documentation improvement for the physician.
Okay, and then how do you go about doing that? Do you do that at committee meetings, or how does that happen?
Yeah, we do have physician champions when it comes to AFib from the EP subcommittee for each of the 5 hospitals. And so when we have communication blasts that we want to do or one-on-one conversations, we tend to reach out to them to ask them to speak to physicians at their particular facility.
That's excellent. Thank you for sharing that.
Sarah, this is Takia. I'm just curious, what new EHR are you transitioning to in your facility?
We have Cerner.
Cerner, okay.
Does anybody else out there have Cerner that have figured out a way to be able to document easily the CHADS-VAS score? No. I think Richard brought up a really good point there about, and I know that the biggest issue, trying to get all of these measures, get the physicians to document what you need to document, like you said, especially, Sarah, if they're a history of rather than a new onset. However, if you have a sheet like Richard has, then and having the nurses kind of document it and then calling them might be something. If they get enough calls, do you think that would help for them to actually start remembering to do it? It's just a thought.
Yes, but there's a very big push to not use paper forms. And so, yes, we've had that in place. Yes, that works. Yes, I advocate for it. Yes, I agree. That would work.
Okay, and I don't know if it's easier, well, I don't know. Like some of the EMRs, if you can do, actually have the CHADS-VAS score in the charting part for nursing charting when you're doing the medical record thing, and then having the physician sign off on it. I don't know, but there may be something there.
Yeah, we've already gone through the process of what needs to happen. We're just waiting for the okay to actually do it.
Yeah, which can take a really long time, I know.
Right? Yep. Thanks.
Yes, thank you very much. Anybody else have any comments? So, let's see. I think those probably are, when I looked through to see, it was the thing that seemed to have the most problems was the CHADS-VAS score and then also the statin. So that seems to be an ongoing thing. I will take a look at the coding instructions, too, to see if there's anything new or different that I can post or send to you. So, again, if you register, then we'll have your contact information and can get the information to you and or let you know when all of the different, because all of our exchanges are planning on posting some resources on the Southwest Affiliate website so that you will have those available to go to. So speaking of resources, I'll talk a little bit about that next. Actually, yesterday what I did was I just went in and Googled Get With the Guidelines, GWTG AFib, and the National Home Office, actually, their website came up, and there is some really, really good information on there. So I don't know if any of you have actually taken a look at that site, but let's see, I was going to tell you some of the things that I found on there. I know one thing was patient education. There's a whole lot of really good information there on patient education. There are some webinars that are posted there that you can go to, and one of them actually was done by Dr. Bill Lewis, who is our AFib, Get With the Guidelines AFib champion for the American Heart Association. He is out of Cleveland, Ohio, and has been working with the program for quite some time. And so he has actually gone through, him and another physician have actually gone through each of the measures for 2016 and kind of gone over what the changes are, how to implement it, ideas, just different ideas. So it is really very good. I will post those websites so that you can find those. But I think that might be very helpful for you if you get a chance to listen to it. It's about an hour is about what it takes to get through that one. And then there also are a couple other webinars listed there. One was on left atrial appendage closure for stroke prevention. So they're all about an hour each. And then the third webinar that I saw there was targeting a new area of AFib care, introducing Get With the Guidelines AFib, the ablation feature. So if you are starting that ablation feature, that overlay that, it's free of charge, just letting quintiles know that you want it, then there is a webinar that may be helpful for you to just take a look at and see what's there. The other thing I think that's kind of exciting, and I'm not sure at what point it happened, but I think it's just been within the last year, is that the American Heart Association and the Heart Rhythm Society are now working very closely together. So they are working together to make sure that the guidelines that we use are appropriate, the achievement measures that we use are appropriate, and then just trying to help to promote the ablation, the education, and all of those things. So that might be, I think it's really good that we're working together with other societies that can help to continue to improve the care of our patients. So I'm at the AFib website right now, and there's an area that says find out how the program can help you. Just kind of gives you an overview, and there is a couple little short YouTube videos on those sites too that might be helpful for you. You can submit the data, the tracker, so there's tools for that. There's clinical tools that can work, so there's AFib fact sheets. There's AFib data elements, so you can download that if you go to that website. So they're all linked. There's a post-ablation follow-up. There's an ablation feature fact sheet. And then the CHADS VAST assessment toolkit. So there's actually a toolkit posted there for the CHADS VAST assessment. If you want to take a look at that, if that might be helpful for you. The other thing that's listed on there are the treatment guidelines. So the newest ones that were published in 2016, I believe it was July of 2016, were the ACC and the AHA, the clinical performance and quality measures. So those guidelines are now available. There's a link that will take you right to the research article that was published for that. So that might be helpful for you. The next little box has Explore Professional Education. That's where you can find those webinars and things, and there's other education as well. But if you want to take a look at the webinars. But the one that I found most fascinating and most amazing was the patient and professional education. So if you go in there, there's actually an interactive AFib patient guide that if you click on that, then you can use some of that information. All of these you can open up, you can print, you can download, you can send your patients to them, anything that you want like that. But there's also a partnering in your treatment, which is looks like a really good educational sheet that the patients can put in there. They can answer, so you could answer questions like, why should I take this medication? What should I expect from it? Just some good patient education materials that you can use to educate the patients, and then they can take home with them. There's one on how well are your medications lowering your risk factors. That looks really good. There's actually like an algorithm for guidelines for treating AFib that might be useful. It's downloading right now. Yeah, so it's simplifying your atrial fib treatment plan, and it goes through how do I prevent a stroke, does my heart rhythm or rate need treatment, and then there's actually an algorithm and telling the patients a little bit about the CHADS VAST score and then what kind of things that they can do to help improve, to do better. So that's a really good one. There's a symptom tracker that you can send with the patient. There's a medication tracker, and that's in Spanish as well. There's frequently asked questions about AFib. There's the CHADS VAST interactive risk calculator. That's maybe what we should do is give it to the patients, and they can calculate their risk. And then there's the AFib talking about anticoagulants, so direct-acting anticoagulants. There's a heart care channel. There's just a lot of information, and if you scroll down a little bit more, there's printable AFib fact sheets that you can print out and give to your patients. You can tell them, it talks about the EP test. You can do ones about stroke. warning signs for stroke, and all of those things. So those are really great areas if you're looking for some resources to use to educate patients and things. There's also an area targeting a new area of AFib, introducing the Get With The Guidelines AFib ablation feature. So there's some information on that. And then there's information on the Public Recognition Achievement Award. So with the AFib module, we have the Bronze Award, we have the Silver Award, and we have the Gold Award. At this time, there are no Plus Awards for the AFib module. Any questions or comments about any of that information?
Yeah, this is Richard with Doctors in California again.
Okay.
Yeah, I was looking at the coding instructions, and I couldn't find any reference to the LDLs with the statins. However, I do have a webinar that was given by Get With The Guidelines in January 24th of this year. Okay. And it actually says in here, patients with no CAD, diabetics with this age, LDLs less than this, and a stroke. So I guess if it's all that plus a stroke, then we can use it as a standalone. Okay,
yeah, let me double check with our the National Center to make sure that I'm not giving you wrong information. Okay. So I think from what it says here, yes, it should, but I don't want to give you I don't want to misinform you. So let me do the check on that, and I will have that posted for you. Okay, and where do I find it posted? It's going to be on the Southwest Affiliate. So if you type in QI Southwest Affiliate and type out Southwest Affiliate, then that will bring you to the area that if you scroll down, there's the webinars and then there's the exchanges, and it will be located in that page. And we will send information out so that you know that once we get all of these things answered and posted, then you will have that available. Okay, sounds good. Thanks. Okay, thank you. Any other questions, comments? One other thing is, let's see, I wanted to call your attention to is that Dr. Lewis, who, again, Dr. William Lewis is in Cleveland, Ohio, and he has a publication that in the EP, let's see, what's it called? EP Lab Digest. So there's an article in there that talks about Get With The Guidelines and how they use it. It's in the July 2017 issue. So I will have that included in the references if you want to take a look at that as well. And again, he is our lead for the AFib National Center. Okay, let's see. So that's getting close to what we have on our list. But again, we want to hear from you. So is there anything else that anybody would like to share, would like to talk about? Anything for our next calls? This time we just kind of put together some general information, but we really want to be able to answer your questions or find resources for you or do what we can to help you. So if you have ideas for those things, then either let me know now or go on to that registration site and let us know in that information. You can always go to SWAQI, is that right? Yeah, SWAQuality@heart.org and send an email, and we can help you with that. The other thing is all of our directors, so something new that we're really, really working hard on and trying to do more of is helping with your quality improvement through the American Heart Association, the Directors for Quality and Systems Improvement. So if you're having issues or you want some help, or, your directors from each area have a lot of resources that they can go to and other people they can talk to and maybe help you to determine a good way to address any particular issue that you may have. So we are all available for one-on-one consultations to help you with whatever you need in your performance improvement journey. So feel free to reach out to myself, Deb Most, or to your director in your region. If you're not sure who that director might be, then send that email to that swaquality@heart.org, and we can certainly get you hooked up with your director. Any other questions, comments?
Steph, this is Takia. Just one last thing. I wanted to just remind everyone that September is AFib Awareness Month. So just remember, take this opportunity to raise awareness about the disease in your facility, with your patients, and also in your community. So the AHA will also be hosting a live Twitter discussion with the HRS, Heart Rhythm Society, next month also to generate discussion and promote awareness of AFib. So just be on the lookout for those dates to come through, and you can join the conversation. Thank you.
Thanks, Takia.
Oh, sure.
Anybody else have any comments or questions before we wrap up? I really hope that you're finding this helpful. I think we're going to get better and better as we go on. Again, this is our first exchange call, but I think that together we can really address a lot of things and bounce off ideas, and it's the best way with peer groups, peer information. Everybody tries different things, and sharing that information can go a long way in improving our patients' care. So if you please remember to complete the registration at heart.org/SWA quality, or again, just type in Quality Southwest Affiliate or QI Southwest Affiliate, and that will take you to there. There are also the 7 questions. If you would take just a minute or two, it shouldn't take long to answer those from today's call. We would really appreciate that. So unless anybody has any other comments, which I'll wait, just pause for a minute here. No? Okay, well, please feel free to contact your directors or any of us, and thank you so much for participating today in the call. We will be meeting again near the end of October, so watch your email for dates and times. This time we didn't do registration. We're not sure if we're going to do that next time or not, but one way or the other, your directors will be letting you know when that call is coming up. And I think what a lot of them are doing is actually sending you a calendar invite so that you remember that the exchange call is coming up. So again, thank you. We appreciate your time, and thanks for joining us. Have a great day.